If you're an alternative health practitioner and you're finding it difficult to deal with today's modern illnesses, and as a result, you're perhaps struggling to grow your practice, this episode of the Business Alchemist podcast is for you. I'm joined by an old friend of mine, Trevor Gunn. Trevor Gunn is a fascinating mix of backgrounds. He is a medical biochemist, he's a homeopath, he's a lecturer, and he's an author. And I'm really pleased to have Trevor Gunn on today's show. Trevor, welcome to the Business Alchemist podcast.
Thank you, Phil. Thanks for the invitation to be on the podcast.
No, I was really looking forward to this because I like a bit of alternative thinking. And I know that you've been an established alternative health practitioner for many, many moons. And I know that you're helping independent alternative health practitioners think about their practices in a different way. So how about if we just kick off, Trevor, by giving us a little bit of background context as to what you see. What's the problem? What's going on in alternative medical land that has made you come out and do something different?
Yeah. The central problem, I think we can get to this quite quickly, is that illnesses are defined effectively by the drug industry, believe it or not. And they're essentially defined as things that go wrong with the human body. So we have this catalogue of illnesses of things that go wrong, and they can be things that we know about, like appear to be attacked by certain things like viruses and bacteria and what have you. There appear to be certain malfunctions. The body, with neurological illnesses, nervous system disorders, heart conditions, and so on. And there's even things where the body appears to attack itself, so with autoimmune disease and so on. So there's all this kind of malfunction happening. And as a consequence, practitioners are there to kind of, on the face of it, put the body right. Now, a lot of alternative practitioners don't see it exactly like that. But the more detail we get from, modern day biochemists and research scientists and so on, the more it appears to be that way. So, and in that way, on the one hand, we're seeing the body as malfunctioning, and yet there are many alternative practitioners that help the body in some way, shape, or form. And I think they're kind of missing a big trick, they're missing a certain paradigm in that modern day illnesses, in terms of the research, the science, and so on and so forth, actually shows us that the human body is not going wrong for the most part. It's responding to the environment, it's responding to our world. And so what we see as malfunction is often intelligent design in terms of the body reacting to situations in order to heal. So it kind of appears like an old esoteric idea that the body is self-healing. But actually, if you look at what's going on, even in terms of the biochemistry, you'll see that that's actually true.
Wow. Okay. So Go on, carry on.
So then if we can understand it in those terms, we actually start to see disease differently, and we can use the body to help us in ways that that's not so apparent if we just take an orthodox diagnosis. So if somebody has an autoimmune illness, that it would appear that you have to somehow regulate the immune system because the immune system's trying to attack itself. Whereas actually, if you can understand why the body's doing that or appears to be doing that, what often you need to do is help the body and not stop these processes happening. And so if alternative practitioners learn their pathology and biochemistry differently, it would be easier for them to practice. Is my thought.
Okay. And why? Why would it be easier for them to practice? Because I guess there's orthodoxy. Orthodoxy's been around for, I guess, as you say, ever since the drug industry got going. And that's the prevailing way of thinking about these, as I opened up modern day illnesses. Why are you suggesting that that today's alternative health practitioners need to think about those illnesses differently?
Yeah, I mean, mainly because we've kind of followed medicine has kind of followed a certain track, and it definitely has its place. It's not like it's completely wrong about things. It's just it's focused on certain areas, and I suppose we'd have to use an example. If you an example like somebody getting a fever, um, that can be uncomfortable, and it's often associated with pain and inflammation and so on. So you might take something to reduce all of that. And as the kind of medical practitioners, or not even medical practitioners, medical researchers really have gone into more and more detail, what they find is they find more and more detail about that process, and they find more and more ingenious ways of holding that process back. But from a bigger perspective, we have to ask, okay, well, why has somebody got a fever? And why is there an inflammatory response? And if you take a more, which would be considered a more holistic view, if you take a kind of broader perspective on that, you'd find that actually that there's a reason why the body's raising its temperature and it's raising its blood supply in a certain area, and the blood vessels are leaking out white blood cells. This whole design, really intricate, clever design that the body is using to deal with a problem. And but we tend not to learn things that way because we're completely focused on the medical perspective, or the orthodox medical perspective, in terms of what's happening that shouldn't be happening. So of course we don't want to have a fever, and we don't want to have a raise in temperature, we don't have inflammation. But if there's something going on where our body needs to do that, then that's exactly what we need to do. And that's just the tip. That's literally the tip of the iceberg in terms of medical diagnosis and how we understand pathology, as in what's going on in disease. And if we could understand what was happening, we could, instead of trying to hold that process back to get relief, we might want to actually speed that process up to get relief. And so on the one hand, we've got the process trying to deal with the problem, and the other hand, we've got the problem. What's the body responding to? And in that way, we tend to ignore the problems and focus on the reaction of the human body, and just get more and more involved in the detail of the reaction without ever standing back and say, why is the body working that way? And so I guess, in answer to your question, why do alternative practitioners need to do that, and how's that going to help them? Because there's this barrage of what we would consider, or I would consider, orthodox medical paradigm that gets thrown at us all the time, and defining what diseases and defining what these things are. And they're actually a kind of narrow perspective view of a particular issue. And that issue is the reaction of the body to something. And as a consequence, we're focused on what the reactions are. We're spending a lot of time and money and drugs and trying to get those reactions down. And we're not looking at, one, what we're reacting to, and two, what's the intelligence behind that? And three, may I add, the consequences of just stopping the body from doing something that it actually really wants to do. And if we've got all of those things in place, in terms of, okay, maybe we can help, maybe we can remove the cause, and we can avoid problems by avoid problems by not using drugs unnecessarily, then we'll find that our practice is a lot easier.
Okay, so I'm not a medical practitioner, and I'm not an alternative health practitioner. So I can only try and summarize and understand what you've said. So if I was to try and paraphrase from a layman's perspective, it sounds to me like you're saying the way that we think about illness from a mainstream perspective, it's causing us problems. So, and as you explained, that very simplistic, you called it the tip of the arrow, I think. Something very simple like a fever. Yeah, the iceberg. You're saying like a fever is actually doing something intelligent. But of course, mainstream doesn't look at it that way.
And they don't look at it that way, and they will go on. Yeah, they will also be inclined to say, well, there are dangers of the fever. There are dangers of these things. So one of the things, especially with children, is what they call febrile convulsions. It's not so much of an issue when you're older for some reason. And so they will, in a way, they play up the dangers of these things. And actually, from orthodox medical research, a febrile convulsion itself is not anything dangerous. It sounds dangerous because the idea of a convulsion affecting the brain and the nervous system and so on. But from the medical research itself, the febrile convulsion is not dangerous. It's the underlying issue that's dangerous. So, and what a febrile convulsion is effectively is when the body kind of shuts down its kind of normal physiology whilst it focuses on its immune system. So the body does that all the time. If you're stressed, you're going to shut down various systems while you focus on this area that the body perceives you being under stress about. If you've just eaten a load, you're going to feel very tired because your body's focused on digestion. So, and in health and illness, that happens, right across the board in all kinds of situations. So, a febrile convulsion, although it sounds dangerous, it's actually something that happens when there's what the body perceives something to be quite a threat, and it can't do both things at once, so it kind of shuts down and deals with the illness, and that's what a febrile convulsion is. So we often kind of, make these other things sound really scary, so that we can then say, okay, I'll take that drug, and that's just basically marketing.
Yeah. Okay, so it sounds like at a basic level, you're questioning the way traditional orthodox medicine looks at illness. And I know I'm jumping a little bit, but it sounds as if you're saying that there's a very symptomatic approach as opposed to looking at the underlying, what's actually happening here. Have I got that right so far?
Yeah, so you could definitely paraphrase that into saying it's symptomatic. So let's look at the symptoms. Let's look at what the body's doing. Let's look at how uncomfortable it is, and let's kind of alleviate those symptoms, but without necessarily looking at why that is happening in terms of what's the body trying to do, one thing, and why that's happening in terms of what the body's reacting to. And of course, that can then expand, because not only have we got a body, but we've got a mind. And if you're in one state of mind about something, you're going to react differently than if you're in a different state of mind. So there's lots to consider, but as you say, yes, it tends to be very symptomatic in terms of just alleviating pain and so on. Now, that has its application in lots of, let's say, emergency scenarios and certain things where you have to kind of stop things quickly. But what we tend to do is then we tend to take something that has a limited application and apply that to all kinds of scenarios where you'd be better off doing different things.
Okay, so how does this manifest then in terms of the overall health of our country and I guess countries in the West? Because I guess if if I was from orthodoxy, I would say, well, hang on a second, we've got lots of experience, and we've been doing this for all these years, and we know how to help people and to get people healthy. What would you say to that mainstream argument against your attacks?
Well, hopefully I'm not attacking, but but what I would say, and what a lot of people realise, of course, is there's lots of chronic disease, and there are a lot of situations where people are going to their GPs or they're using pharmaceutical drugs, and they're not fixing. What they're doing is they're just palliating, and what they realise is they also have to keep taking these things permanently, so they're not really changing anything, or healing anything, or curing anything, or fixing anything. So that's part of the problem, and it's not to say that none of them do that, or that none of them can help. But it's a lot of the time what you're doing is you're repressing the reactions of the human body, and then luckily the human body can work in spite of that. So we know, for example, that if you take, the research for a long time that shows that if you take paracetamol for chickenpox, say, which is a childhood illness, then the disease just lasts longer. So you might slightly alleviate some of the discomfort, but it goes on for longer. So we know that, and so that's an element of the questions that we have to ask is, okay, but what's the consequence of using that thing to alleviate the condition? So although they're really good at that, the medical profession, drug industry, the whole research machinery, shall we say, is really good at getting to the detail and holding things back when it comes to your overall health. That isn't necessarily helping. So we see there's lots of conditions that are increasing now that weren't there before. Lots of autoimmune conditions we know are on the rise. We know there's anaphylaxis on the increase, which is severe allergic reactions. Cancer's on the increase, neurological illnesses, things that affect the internal systems of the body. There's all kinds of chronic conditions that are in fact increasing. So I think the numbers of, if we think about people having 1 or 2 or 3 chronic conditions, is likely to go up from 30% to 40% of the population in the next few years. So that's the reality is chronic disease is on the increase, and the reality is people have many conditions that can't be treated. And interestingly, a lot of those conditions can be treated by people in alternative healthcare. We actually can treat a lot of those conditions now. Everybody's an individual, so you can't make guarantees and what have you, but there are a lot of things we can do by doing things differently, basically.
Okay, so the backdrop is we've got lots more chronic health, and I think that's pretty obvious, and I'm sure there's lots of stats that demonstrate that. I guess even the obesity epidemic, we know that there's a real problem with obesity and type 2 diabetes and et cetera, et cetera. So the backdrop is chronic illness is on the rise. There's more and more pharmaceutical prescriptions to deal with the symptoms of that chronic illness. So where does that leave? And you're saying that alternative health do have strategies to deal with these conditions. So what's the problem from an alternative health practitioner perspective then?
Yeah, well, for certain things, yeah, it's true. For certain things, it's more obvious what the strategies could be or what the solutions could be. So especially when we think about things that are diet related, like obesity and diabetes, which has knock-on effects in terms of heart disease and so on. So for certain things, it's more obvious that these things are related to lifestyle. But for other conditions, they're not obvious. And the way that we are presented, the condition is like, if you've got an allergy, then we'll say that, people don't understand those things at all. So they just think they've developed this thing, they've got an allergy to something, and there's something wrong with them. And so they either try and avoid it, which is part of the strategy, which also helps. But they don't necessarily know how that allergy has arisen and what's going on with the human body, and why would the human body react so strongly to pollen, or why would the human body react so strongly to a peanut oil, and so on, because that also appears like malfunctional. But and so as we're approaching those symptomatically, or even approaches those from what we think is the pathological issue, at most what we try and do is fix the patient and avoid the allergen. But really, even allergies have developed over time, and that's the thing that we don't get from orthodoxy is that you get these diseases. Like I've just got lupus, I've just got Hashimoto's disease, I've just got cancer, I've just got rheumatoid arthritis, and what that diagnosis doesn't tell you is how did that patient get to that place. And there are a whole load of stages that people have to go through to get to those illnesses, but for the most part, patients don't understand it, and a lot of the time alternative practitioners don't understand it because they're not taught that, and we're not taught that through modern medicine, and a lot of that is not even getting into the colleges. What happens in the colleges, they have to learn modern medicine to some degree, and then they learn their therapy, which is a slightly schizoid way of doing things, because modern medicine, it doesn't really tie in to what they understand by their therapy. And so that's the problem, is when you're getting diseases that don't appear to be obvious in terms of problems and solutions. And then practitioners are having to try and fix the person without knowledge of how that patient really got there pathologically, and without knowing the little adjunctive things that they could do to help them out. Because for the most part, the disease is presented as though it's a problem with the person, like you've got your body attacking yourself, or you're just hypersensitive. And so now we're trying to fix the person. The alternative therapist is trying to fix the person. If they're really good at the therapy, they can do, but it makes it very difficult to practice if they're having to deal with an illness that actually started some time ago, and they're not that clear of the pathway to that illness. And so that's where I think I can help in terms of how is it that these illnesses arise. And it's not that I have found these things out, it's that the research is there. It's that the research from orthodoxy is actually there, but it's not publicized as such, and it's not presented as such. And so if we understand how modern diseases are created, how we develop into them, if you can also explain that to the patient gets a bit of an aha moment. Think, okay, that's how that came about. And they realize also that I have to do X, Y, Z to get out of that situation. It's not all down to the therapist. So, it makes it a lot easier for the therapist if they can see a trajectory to that illness and a trajectory out of that illness, and they become a partner with the patient as opposed to somebody that's there that has to fix everything for them. So hopefully that answered your question in terms of, yeah.
Yeah, okay. So that sounds like a very tricky scenario. So you've got mainstream medical orthodoxy that treats symptoms and doesn't really look at the root cause and doesn't understand how a patient has got to where they've got to, depending on the severity of the symptoms they're presenting with. And you've got alternative health practitioners that have a completely different way of thinking about health. However, they're trained to try to understand their patients from how to fix their patients using a orthodox philosophy and way of doing things.
Yeah, in using an orthodox diagnosis. Because somebody comes to you with a diagnosis of an illness. I've got diabetes. So that suggests that my pancreas isn't working right, or whatever the deal is. And so now we have to try and fix that patient. We know that they shouldn't be eating lots of sugar and all that kind of stuff, but we don't really know how that patient got to diabetes and what was the intelligence behind the diabetes. Because on the face of it, diabetes is a malfunction. Well, actually, it's functional.
Wow.
There's an intelligent, functional approach to why your body becomes insulin resistant. But we're not taught that, or most practitioners aren't taught that.
Well, that sounds
because it's
pretty,
all
Go on, carry on.
So as a consequence, No, go on, you carry on.
That does sound pretty radical. If I've understood what you've said, that the illness is in fact an intelligent reaction.
Yeah. So that's the thing that's a little bit of a paradigm shift. And again, on some level, a lot of alternative practitioners may know that. For example, in homeopathy and naturopathy, certainly in acupuncture as well, and traditional Chinese medicine, they look at flow of energy and what have you. And in homeopathy, we tend to use remedies to stimulate healing reactions, to stimulate the current reaction. So it would suggest that we want the current reaction, but we don't understand why we would want the current reaction. So that's why I say it can appear a little bit schizophrenic in terms of you're wanting to do this thing from your therapy point of view, but everybody in the outside world is saying this is a dangerous, malfunctional thing and you shouldn't really be reacting like this. So, and of course, nobody wants to react and be ill, but we have to understand why that person is doing that. And then it's just a lot easier to practice.
So what I'm hearing you saying is the illness itself is an intelligent reaction to something that's going on, and that something that's going on is the kind of what's the root cause? What's the root cause of the illness, or what was the progression from way back to where we are now? Okay, and how is this impacting the alternative health industry today?
What, the lack of that knowledge?
Well, because that sounds like a pretty messed up backdrop. Because I guess if I just think about my own family, for example, my own family may have I have illnesses from time to time, and our first normal reaction would be to go along to see the doctor. The doctor would have a look at what's going on and prescribe a medicine. 9 times out of 10, the doctor isn't asking, how did you get this? Or what was the build up to this? The doctor is normally just providing a prescription to deal with the symptoms. So, and again, from my own experience, if I don't get if that's not cured over time, I then start to think, where else can I go? And I would potentially end up at some alternative health practitioner. And I guess that's why we have an alternative health industry, because I guess the mainstream can't fix everything. So therefore, you've got groups of different philosophies of alternative health that are there to, I guess, sweep up after mainstream isn't able to fix stuff. Now, I guess there's a whole bunch of people who would prefer to go to alternative health practitioners in the first place, so that's cool.
Yeah.
But it does sound like quite a complex background, and I would imagine that that's quite tricky for alternative health practitioners to navigate.
Yeah, and it's becoming more and more tricky. So, the more medication that people have, the more intervention they have, and the more chronic diseases there are, it's getting harder and harder to treat those conditions. So, on the one hand, you'll find, yes, there are people that go to alternatives because they would rather do that first. But then if certain things happen, they would go and see the hospital or go to the GP. So it's not like it doesn't happen the other way around as well. And then there are people that will do all the orthodox stuff, and then when nothing's working, they'll go and see alternative practitioners. But yeah, one of the key messages is, what happens when you have your fever, or you have your vomit and diarrhea, or you have your inflammatory reaction. When you have these what I consider primary reactions to things, and you persistently suppress them, you persistently stop your body from doing them, then you're going to end up with something else. And that's the kind of unraveling that we have to do in alternative healthcare, and that's also happening, for longer. People are taking medication for longer, and so you're getting them much further down the line, and that's where the difficulties are coming in. That we're having people that have been suffering the side effects of things, and they're also suffering the suppressive effect of something, which we often don't consider. If you've just eaten a poison and you take something to stop yourself having vomit and diarrhea, and of course the vomit and diarrhea is something designed to eliminate the poison. But now if you stop that, the chances are the poison can get further into the body, and now you're dealing with something else. So, and those are, in a way, not so much the side effect, it's the suppressive effect of the medication. And for the most part, most people don't consider that at all. So there's that element in terms of, educating the public, but then what happens to the human body in terms of pathology. And then there are all these pathological states down the line that then get called different names as though they're completely unrelated to these things that happened before. And that's when the alternative practitioner will find it hard to treat them, because they're not necessarily aware of how those conditions start and where they start, because they're just taught these things as though they were separate conditions. And that's rife throughout alternative and orthodoxy, that these things are separated and they're not linked to what happened before or what's happening after. And so if you can actually make those links, you can obviously make your life a lot easier in terms of treatment and helping people. Yeah.
Okay. So perhaps at this stage, it might be useful, because we've been talking really in conceptual terms, I guess. Well, not just conceptual, but it might provide a little bit more insight for the people, the alternative health practitioners who are watching this, to maybe understand how you got to where you are. Because even when I started your introduction, I'm sure it won't be lost on people that, you were I didn't say this, but I know that you were trained as a medical biochemist. And
so what was the journey?
So what's the, you're a medical biochemist, a biochemist, and then you jumped ship, it sounds as though, over to alternative health, so what was your journey for that? What led you to taking that path? And I guess what that will do, that will give us an insight as to why you've come to the conclusions that you've come to, that you've just described over the last 20 minutes or so.
Sure, yeah. So it is a question that I've been asked a fair few times over my life. um, and I guess the answer might even change from how I'm feeling from one day to the next. But in any event, um, biochemistry, I mean, I was always interested in health. And to be fair, I was always interested in how things work, to be honest. As a child, I used to break my toys apart. And looking back, I was kind of, luckily my parents were relatively forgiving and understanding, but they didn't see me as being really destructive. But I kind of sit back and I think about when I was a kid, and it looked, as we can all do this, we can kind of imagine ourselves in our mind's eye. And I would just have to know what was going on inside that thing when something was moving around or some lights were on. It was some people, you can consider it curiosity, but it was a compulsion. I couldn't just watch this thing. I couldn't watch a toy work and do something. There was a part of me that I had to sit on my hands because I just wanted to know what was inside. And I actually forget that to a large degree. But I think, as an extension of that, I was just kind of interested, okay, how does stuff work? And the human body was, luckily I didn't take it apart, but the human body was just one of those things where I just thought, okay, what's this all about? And that became a fascination as I grew older. And so that was always my interest, really, is like, how does the human body work, and how can we cure disease, and how could we create health and what have you? So it was obviously very naive when I was young, but that's how it was. I did actually have an uncle who was a medical biochemist of all things. And he was actually a great character, and I liked him a lot. But interestingly, he was always interested in medicine. He went on to become a doctor and so on. He was interested in becoming a medic, and I wasn't interested in that at all. For me, it's like, no, it's much more interesting to find out why things are happening than it is to just prescribe stuff that somebody else did the work on. Anyway, that was my thing to get into biochemistry. So I go to Birmingham University to study biochemistry, medical biochemistry. In my mind, I'm going to find out how the body works. I'm going to, fulfill all these desires that I've had for years and years. But then when I get to university, I'm studying biochemistry. It's really it's a very reductionist, quite geeky process. There's lots of maths involved, lots of equations and physics and chemistry and so on, and which is one thing. But we're dealing with the minutiae of certain details of the human body, and we're all specialists in various areas and so on. And what that kind of does to me is I kind of realize that it's far from knowing what actually happens to a whole real life person. And that when we're finding out these details, there's a lot of work to do in terms of the context. What does that mean for a real person? And what I found was that biochemists and the pharmaceutical industry are really kind of taking a lot of chances with the human body, because we really don't know what's going to happen until we do some pretty good trials and so on. And there's a lot of work you have to do for years before you get anywhere close to putting something inside a human body. So there was, in some ways, okay, that's inevitable, but it just seemed a kind of huge gap between our kind of geeky, detailed knowledge and what we need to know to really help people. And I think basically, if I go back to that, it felt like we were really taking a lot of chances and we didn't really know what was going on. And at best, we can do something that had some kind of short-term effect. But what was the long-term effect of these things? What are the extended effects of these things? It was all really unknown, I think. And, on some level, I think a lot of people put a lot of faith in this that is kind of misplaced, because as we know, there are lots of things that we do, and at some point later on, we take these drugs off the market and so on. In any event, for me, as a young undergraduate, it was fraught with problems. But anyway, having graduated and spent a very short time in biochem, I also realized that we spend, hundreds of hours finding out the most minute details of, red blood cells and their membranes and what happens and so on. And it just basically took a lot of work to find out very little. Now, on some level, I'm really glad that a lot of people do that work, because there is a lot of application for it and it's really useful. And I think all that work's really useful. I'm really down with knowing exactly what's going on in the human body and so on and so forth. But at least for me at that time, I was somewhat disillusioned in its application in terms of real health. The other thing that happened is that I was also really interested in martial arts. and as a consequence, acupuncture and Chinese medicine, the whole Chinese tradition. And I couldn't understand for the life of me how somebody could put a needle in one part of your body and fix some chronic disease somewhere else. So it just looked like I really didn't know fundamentally, in principle, how the human body worked, even though I had all this biochemistry knowledge. So and of course, the other thing that I sometimes tell people is that I had a professor that died of cancer. On the face of it, he was this expert in the cellular mechanisms of the human body, and he died of something, and he probably had no idea what was going on with him. So that also threw a spanner in the works in terms of, okay, what do I really understand by what's going on, and do I need to do things differently? So I kind of came out of that. Actually, I did philosophy at Open University. I did actually some other things that that probably never gets aired, but did a lot of traveling and eventually found homeopathy. And what was fascinating about homeopathy is that Samuel Hahnemann, the guy that supposedly developed that, he was looking at China bark, this bark from a tree, and which the substance was effectively quinine, and that was used for treating people with malaria. And he didn't understand why it worked. And so what he did is he took it himself, and he ultimately, with homeopathy, gave them to people that weren't ill. And what he found was that they came out in the symptoms of malaria, the people that weren't ill. So what he kind of deduced was that the quinine, the substance, was helping the body to produce the same symptoms that they do when you have malaria. And therefore, when someone has malaria, this parasite that's in their blood, their body needs to react to that. And if you give them quinine, it helps that reaction. So that became this whole system of homeopathic medicine, whereby you actually help people's bodies' reactions when they are ill. So, ostensibly, if someone's vomiting, you give them something that actually helps that process. Now, that process is actually quite involved. We might see that as a symptom of vomiting, but there's all kinds of internal things that are happening. And by matching all of those symptoms, you can get a remedy that matches that state. And that, in fact, helps the patient. And to me, that made a lot of sense. It meant that you actually didn't need to know all the details of the biochemistry of it, even though you still need to know what's happening with the body. You need to have a language to know what's happening. And so my biochemistry was always useful. But it was an approach that really appealed to me, and I then went on to study homeopathy, and and was able to somehow marry the two. Because the other thing that was really important to me was, okay, why do people get ill? People aren't becoming ill because they haven't had the right homeopathic remedy, becoming ill because of how they were living their lives or something. One of the things that I noticed very soon after qualifying was that I had a patient that was unwell. She had all kinds of bowel problems and digestive disorders and joint inflammatory issues. And she just stopped eating bread one day. And I would have to say like 90% of her symptoms got better. And for me, that was like a real revelation. And it became really super important for me to find out, okay, well, what are the things that people are doing that's causing their ill health? Because even if I could help them with my homeopathy, even if you could help them with your medication or your therapy or whatever it is, unless you're addressing why they're getting unwell, they're going to be back in the office, in the next month or next 2 months or whatever it is. So it became super important to understand why things were happening. And I think as a consequence of that, I really got into the whole business of causation and looking at diseases from that perspective. And on top of that, we're looking at how medication affects people. So already I have this thing that you can help the symptoms or you can suppress the symptoms. So it became really important to understand what happens when you suppress them. If you've eaten something, or let's say you've got malaria, you've got this parasite in you, and you take things that just stop the inflammation, that stop the process. What happens to that human body? Do things get worse? And you find that they actually do. So on the one hand, we've got, okay, what are the things that are causing this illness? What happens when they take medication? And how do these symptoms and pathological processes progress? And then you find that there's actually lots of evidence and lots of research showing you what happens in these scenarios. And so this idea that the human body is intelligence in its response in disease is actually known within the research. It's not like I'm actually doing that research. It's there for people to look up, but they obviously have to join the dots when it comes to a real life patient with real diseases and so on. So yeah, in a way, that was my journey.
So you're saying this wasn't just a theory that you came up with on the back of the your disquiet as to what you found as a biochemist, and then coming across the philosophy of homeopathy. You could see there was lots of research that was pointing to the intelligence of the body.
Exactly. And so, for example, there's a book called Darwinian Medicine. I think it's Williams and Ness, two professors. And that talks about how certain symptoms have evolved to protect the human being, as it were. And they may have even done this with other animals as well. But anyway, so there's research out there showing that, okay, why do we have these pain responses? Why do we have these inflammatory responses? Why do we vomit and have diarrhea and cough and all these things? And there's a lot of research that shows sort of why those things happen. But interestingly, they don't necessarily look at what happens when you repress those responses. I don't think that was anywhere in the writings at all. But that was my big thing. Is okay, what happens when you repress these responses? And that's also big in homeopathy to a large degree. This idea of suppression. Suppression is a very key issue. And if you've got a human body that's intelligent, what happens when you stop those symptoms? And often what you then find is you find the trajectory of responses to chronic disease and more what we call invasive disease affecting deeper parts of the body. So yeah, a lot of that research is already there. It's just a case of pulling the dots together.
So that's how that was your journey. Were there any other parts of your history that brought you to where you are now that you haven't told us so far?
Well, I guess the other thing is that on the one hand, I could also see that if you don't have that information, it makes it very hard to practice. So and a lot of people if they're only doing their practice, if they're only doing their therapy, if they've only got their discipline, like be it your homeopathy or naturopathy or acupuncture or osteopathy or whatever it happens to be, when confronted with with various conditions, especially what appears to be the more invasive and chronic illnesses that we see now, when confronted with those illnesses, because they're presented in such a way by, in a way, the medical industry, then it's hard to see why they're there, because it just looks like somebody contracts something serious all of a sudden. But that's never really the case. And interestingly, what that gets people to do is it makes them really afraid of disease. They think that they can get anything at any time. I mean, one of the interesting things about that is, like, especially when we think about infectious disease, when things can affect the brain, for example, measles can affect the brain, encephalitis. But actually, for that to happen, there's a whole host of things that you have to do and repress, etc., to make for that to happen. But because we don't have a sense of that trajectory and that journey, then people do things because they're afraid that X, Y, and Z can happen. And actually, they can't happen for a lot of people. So it also means that, one of the things I notice is a lot of people take, it's a very controversial subject, but basically they do certain things and they take certain remedies and medications and so on because they're afraid of X, Y, and Z. And actually, those things aren't going to happen. And rather than deal with the conditions that lead them to that, they forget about that and they just take medication. So, we've just been through COVID, for example, highly controversial. But we know that there are lots of reasons why people develop what we call severe and critical COVID that could lead to their death. And unless you have a lot of those preconditions, it's not a dangerous illness. And so, but unless people are aware of that, they're going to go and do things that would otherwise hurt them and not do the obvious things that would help them. And in many ways, alternative practitioners and orthodox practitioners are caught up in that. As well. And so unless you've got a paradigm that can really help you to understand the trajectory to serious chronic disease and these kinds of invasive infections that most people are afraid of, then it's easy to get caught up in that process. And then before you'll know it, you're not really knowing how to advise people and how to help people to stop those things happening in the first place. And that's something I definitely noticed in certain childhood illnesses and things like vaccines and what have you, is that people were doing things where they were trying to stop dangerous things happening, but they could have stopped it a lot easier by doing other things.
Wow. Okay. So essentially, you've joined the dots from your background and you've come up with a paradigm that you believe helps overcome the fear that is in patients and sometimes the fear and the concern that's in alternative practitioners in how to help their patients tackle many of today's modern chronic illnesses.
Yeah, I'd say so. Yeah, the short answer is yes, because they happen for reasons, and unless we address those reasons, they're probably going to happen. And then all we end up doing as practitioners is trying to ameliorate them along that trajectory down into more and more chronic disease. And ultimately, what we want is to create health and to show people the pathway to health as opposed to the pathway of disease. And they often crisscross each other. But if we can get people going that way instead of that way, then the outcomes are very different. And it's much easier to practice as well.
And what percentage of, I'm not sure if you know this, but I'd be interested, what percentage of alternative practitioners do you think recognize that this is that there's something missing for them, or that they know they've got a problem? Do most alternative practitioners know there's a problem?
I think a lot of alternative practitioners struggle. A lot do. Obviously, there's lots of people that are successful. It's interesting because I think, a lot of people that are successful, there are also people that tend to focus on certain areas that they're good at. I think a lot of people feel that the reason that they struggle are these kind of external things, like it's free to go to your GP, so people are going to do that over us. The drug companies got more money, so they can advertise their stuff better than us. Alternatives tend to be pushed down and called quacks, and so the public don't trust them. So there's all these things that we know that we're up against, or that we think that we're up against, that I don't think are actually valid. Well, they're all very valid, obviously, but I think you can get around them, basically. So I think a lot of practitioners are aware of problems, and they're aware that it's kind of difficult. I think there are many practitioners that think they need more knowledge of the human body. They think they need to be more knowledgeable, like doctors, and so they sometimes feel that there's something lacking. And interestingly, although I think a lot of that information can help, I think it can also be a hindrance in terms of how you understand what's happening with the human body. So all of those things I think are there, and I think a lot of those things can be addressed if we truly shift the paradigm. So although a lot of alternative practitioners do have a paradigm shift, because of course they're doing things differently and they're looking at the body holistically, my thing is, because of the nature of the world and the medical industry, it's hard for them to stay in that paradigm, that holistic paradigm, when they're being bombarded by illnesses and diseases that are essentially defined by the drug industry. So it's, and that they may not, like as they say, the expression that I quite like, we're being frog boiled into this place slowly over time, where we don't recognize actually we've all, to a large degree, got this mainstream medical paradigm that slowly seeps into our souls, because it's just so pervasive and so dominant in the world, and it seems to make sense. You see, I can pick out a pathology and I can make it make sense from their point of view, but it misses. It doesn't have overview. It doesn't actually say why it's happening, and it doesn't tell us about how that person got there or how to get them out. Because you don't, I think a lot of people could do stuff without homeopathy, without this thing. If we've got a different paradigm, we can somehow unwind ourselves through things. And I believe that the alternative healthcare or the various therapies could help to catalyze when people get stuck. But what actually happens is that alternative therapists are using that alone often the time. It's like they're having to use that whole thing to take the person from Z to A when it comes to rewinding them out of their illness process. And I think that's very difficult, if not impossible, to do for a lot of conditions. And the reason that they've got to that place is largely the paradigm that they live in. And so although practitioners have an alternative paradigm, it's that we somehow have to reconcile that with the fact that we live in this modern world of genes and enzymes and receptors and so on and so forth. And we have to somehow translate that to acupuncture, to homeopathy, to naturopathy, to osteopathy. And if we can do that, life is a lot easier. Practice is a lot easier, should we say. Yeah.
Okay, so that kind of explains how you've got to where you are, and that it sounds as if you do have a paradigm that you've pieced together from both worlds, which makes a lot of sense. So for those practitioners listening to this podcast now, do you have a system that you can help them with then? Like, for example, do you have to be a homeopath in order to take on board your paradigm, or does your paradigm work for any alternative practitioner?
Yeah, I smile because I often forget, no, you don't have to be a homeopath. So because essentially it's about learning learning the intelligence of the human body. So I teach courses, and I'm effectively helping people to understand the paradigm from an orthodox and a holistic point of view. So I believe it's much easier to understand what's going on with the human body, and people can relate to it. Different practitioners can relate to it because it has a much more holistic view. It fits more with what their understanding of why the body does what it does. So we get the detail as well as the overview. So there's that element to the course, is to do, okay, how can we understand the human body differently? And also, what are the consequences? What are the consequences of taking all these drugs and doing X, Y, and Z? And we go through things like that. How do we unravel that from we could say a naturopathic perspective? How do you unravel that from things that we can use in everyday life in terms of diet and supplements and lifestyle and so on? Even thoughts and behavior have a massive influence on what happens in disease. So that's part of the process. The other part of the process that I deal with is the practitioner. So I kind of have one-to-one with the practitioners. And, I recognize that, part of that journey was recognizing that people don't do a lot of things based just on information. So especially when it came to the public, you can tell people, as you can tell people that X, Y, and Z is going to be dangerous. They're not necessarily going to do anything about it. And likewise with practitioners, we've all got our own kind of emotional patterning, shall we say. And so we're going to find certain things easier than others. And even though you've got a bunch of information, a lot of things that are holding practitioners back, maybe other issues to do with confidence and our own health issues that are creating these little barriers for us. And it's really important to look at that. And so I do that with practitioners and help them to kind of break through their own barriers. Because a lot of the time it's personal stuff that's going on as opposed to information. I mean, information makes a lot of difference, but ultimately it's the kind of emotional state that they're in and their own history that will determine how far they will go in practice, I think, to a large degree. So there's that element that's part of the system. So it's okay, we need to know a bunch of stuff about how the human body works, the intelligence of it, and so on. We also need to know a bunch of stuff about ourselves, and that's an individual thing that I do. And then what I also encourage people to do is to pick something. So part of the system is for everybody has their own somewhat area of expertise or interest. So that, and I think it's really good to work with your interest first. So, some people might want to work with women's hormones, or somebody might want to work with gut or skin conditions, or whatever the thing is. So I kind of pick something because it may not be something that I've covered in a lot of detail on the course. But what I kind of promise is that whatever your thing is, I'll also work on that and also reframe that so we can see, okay, what's the intelligence of that? What are the things you can do that will help that's as well as your therapy, and how can your therapy fit with that? And that's also the third part of the course. So it's like, okay, there's a bunch of stuff you need to know about all kinds of things, some stuff you need to know about you and experience, and let's look at something that you can work with. And I think that once people get success, and they're more likely to get success in what they're interested in than to try and do something, fairly abstract that they've learned about on a course. So what's your interest? And as they develop their interest, what you're going to find is they're going to get good at all kinds of things. I think if you can do one thing well, you can do lots of things well. So that's the course. It's kind of tends to be around 3 or 4 months, and it's, I think, for a lot of people have told me that it's a game changer.
Okay.
Many people that are stuck. Yeah.
And so it's over 3 or 4 months, and it sounds like it's pretty comprehensive, because you're teaching from the orthodox perspective and also from the holistic perspective how the human body works. That's what I captured as the first part. Yeah.
How do he works and how do he body functions in disease?
Okay. And functions in disease. Okay. That's pretty important. And then I think you said, what are the consequences?
Yeah.
Yeah.
What are the consequences of not understanding that and taking medication and so on? Because you often have to unravel that. It's rare that you find a patient that's never taken medication.
Okay. And then it seems like then you jumped over to the practitioner journey in their own right. Yeah. And you explained that part of that journey is an emotional one. Could you just say a little bit more about what you mean by that? Because that sounded quite important, really. So you were saying it's not just about the information, you've got to be able to apply it. So is it not just simply a question of applying the new information, the new paradigm, and, hey presto, everything's fine?
Yeah, well, it would be nice if it was, but obviously, often what you're faced with is something. For example, patients come into you and they're scared and worried, and they're going to choose your road as opposed to another road. And some practitioners feel very responsible, and they might not feel very comfortable with that responsibility. Sometimes they're taking on too much responsibility because a lot of those choices are made by the patient. So there's a lot of emotional interactions that a practitioner has that can often hold them back, that they might not be aware of holding them back. There are situations that happen, doesn't always work out, and the patient's going to be contacting you before their next appointment. How do you deal with that? And so on. What do we say to our patients? Because we don't want to guarantee things. At the same time, we want to be positive and we want to be confident. So there are lots of emotional interactions that happen with the client patient. There's also an emotional acceptance for putting yourself out in the world to say, I'm going to be doing this. So there are lots of things that feel like you have to step up to the plate in way, or you have to put yourself out there, that can appear to be scary for some people, and so on and so forth. So there's lots of elements of being in practice where you have to say, this is what I do and this is how I do it, and people that take your advice and so on and so forth, that involves how you are in your emotional being. And you can learn how to do all of that stuff. But what you'll find is that where people get stuck is part of their own history. So in a way, it's like what I do with the practitioner is what I help them to do with their patients as well. So regardless of what you're practicing in, if we can see how that emotional patterning, because that's also part of the course, is how does emotional patterning affect your physiology? So you can sometimes predict someone's got X, Y, and Z disease affecting their body. You can sometimes predict what's going on with them emotionally. And so I want to be able to do that with the practitioner and show them how it is that their own perhaps limitations are part of their own emotional patterning. And so I think that's actually a very important part, because you can do a course of information, but it isn't necessarily the thing that gets you over the line.
So that's the real practical element, to help each individual practitioner apply the new knowledge, the new paradigm. Yeah. Okay. So this all makes sense. I'm clearly not a practitioner, but it kind of makes sense, and I can see that the backdrop. We've got all this increasing chronic illness, and it's not been fixed. So surely we need to do something. So you've had a completely unique background, it sounds like, and you've come to these discoveries, and you've pulled together a paradigm that is maybe not a new paradigm, but I think it's fair to say that this is not a new paradigm, but you're giving it voice because the research is there, demonstrating that the paradigm, this new way of thinking about health, is there. It's not new, but it sounds as though what you're saying is you're coming forward and giving it voice and helping to apply it to alternative health practitioners that may be aware of it, but find it very difficult to apply because of the complexity and the pressure in today's modern orthodox medical world. Have I got that right so far?
Yeah, that's I'd say that's actually quite a good summary. That I am giving something voice that otherwise gets left on the shelf gathering dust because it doesn't service the current industry. And a lot of practitioners aren't necessarily aware of it so much because they're not taught that. I went to homeopathy colleges and stuff, and I've also taught in a lot of these places. And I know that when it comes to disease, they just bring in somebody that knows the standard stuff, or you go and get told to, use the standard textbooks. So it's hard for that to get to the alternative practitioner. So in that way, I'm giving that voice and hoping that I can give that to other practitioners so they can give it also voice. And in so doing, what happens actually is they're disseminating that to their public and to their patients. And that's what makes it easy for them to get patient referrals, because the patients now understand things in a way that they can't understand when they just go to their GP. And they rarely understand when they even go to an alternative practitioner. So what happens is that they might go to their homeopath, shall we say, or naturopath or acupuncturist, somebody, and they might talk to them in certain esoteric terms that don't necessarily fit with what they understand, how they understand the world to be. They don't necessarily understand the terms in terms of yin yang and qi, and also naturopaths tend to focus on detoxing and so on. A lot of things don't appear to be to do with toxicity on the face of it. And likewise in homeopathy, we've got our own languages again, and a lot of that doesn't really fit. But once you start to use the everyday modern day medical terminology and understand how that relates to the intelligence of the body, and you can explain things differently to people in their language, but with a new perspective, a more holistic perspective, they kind of get it. They understand kind of what's going on with them more. They're on board. It helps them to be more compliant in terms of lifestyle adjustments and things they have to make. And also they spread the word easier now. So that's why it tends to help mushroom your practice, because people are saying a different story now, and they're able to tell that story. And that's an experience that I've had. I remember once starting a little course about something. It was above a pharmacy, believe it or not. That's where I used to have my practice. And there was one chap there who was a dental surgeon, and he was on the course, and it was a very kind of introductory course to holistic healthcare, and so it wasn't as involved in this. But it all kind of made sense to him, and the next day he came back. I think it was only a 3-day course. The next day he came back with a load of friends because he wanted them to hear this stuff. So he was like one of my best advocates. But you find that when it kind of turns a light on for people, they're really excited about it and they tell other people.
I see. So I hadn't until now understood the link between difficulty in treating illness and being able to grow and develop the practice. Because it sounds like what you're saying is once practitioners get this, they've now got a language that helps them translate what's happening in the modern world, in the modern medical world, to explain to the patients why and how they've got sick in the first place, and then much easier translate how their individual therapy can help with that intelligence of the body process.
Exactly.
Wow. Okay, makes sense. So if that all seems kind of obvious to me, even though clearly it's not my bag. What can hold up therapists then, from your experience, in being able to take this new paradigm on board and make it work for them in terms of growing their practice?
Well, I suppose what can hold them back let me ask you if I'm getting the question right. What can hold them back in terms of, okay, listening to someone like me and thinking, yeah, I need to do that. I suppose on some level, a lot of people, when they're struggling, they're in a difficult emotional place. And a lot of the problems can appear insurmountable, because on the face of it, alternative practitioners think that a lot of the problems come from the orthodox world, in that, first of all, in the UK at least, you can go and see your doctor for free. There's things that you've got available. You might have to pay more for alternative practitioners. You might have to know what to do in the first place. So it seems hard to advertise. Advertising is not usually something practitioners really want to do. They're not into sales. They want to help people. That's their calling. And so on the face of it, they think that they're not able to. I can't advertise. I don't know what to say. I don't know how to do that. We're up against the drug industry. So all these problems appear insurmountable. And it's that kind of story in their mind that would hold them back, I think. And because to get around that, they would think they have to maybe make promises that they can't keep, and so on. So I think it's that kind of, those kind of stories that they have about how difficult it is that holds people back. Because I suppose on the face of it, they feel that they're competing with this huge industry, and actually they're not at all. Because if you actually do things differently and say things differently, and actually that the huge industry that they're talking about, the pharmaceutical industry, are trying to repress that vastly intelligent human body, it's a lot easier to work with it than to work against it. And when you explain that to people, they get it, and it's quite easy to, convert them, as it were, for want of a better word. So I think the thing that appears difficult for them to overcome is the fact that they have what appears to be insurmountable challenges that I can't fix, or that nobody can fix. But a lot of it is mindset, but a lot of it is how it's set up for them. And we could set it up differently, and I'm not here, because the other thing is that a lot of people are trying to be doctors, and we're not doctors on that level, because doctors, for the most part, what do? They're managing symptoms, they're managing crisis, they're triaging, they're the gatekeepers to other services. They're the gatekeepers to specialists, they're the gatekeepers to surgeons, they're the gatekeepers to all kinds of tests and diagnostic things. And that's not our job. Our job is to to get people healthy. And it's not just about managing symptoms. Our job is to get people healthy. Our job is to get people to feel empowered, is to make choices, to feel empowered to make choices. Our job is to feel empowered to make choices that work for them. we're looking at mind and body interaction. We're doing things that take time, but work on another level. So we're not doctors. We're not doing that job. So we're not competing with them. So that's the other thing, is to like just get out of this idea that we're competing with that industry, because we're not. We're doing something entirely different.
Okay.
So those are things that come to mind in any event. Yeah.
Yeah. No, that makes a lot of sense. I just pick you up on one thing that you said, because you said that your stuff takes time, but you explained in one of your stories about the lady who stopped eating bread, that very, very quickly, 90% of her symptoms went. Yeah.
Yeah. But yeah. And so that's a kind of, in a way, a strange paradox, because on some level, if you can manage to do it, it doesn't take long. But it's like, but you have to manage to get somebody to decide to change their diet, to decide, it's like, that's the kind of thing that takes time. But once they get on board, and once they start, and very quickly things can improve.
Okay.
But it depends it does depend what's going on and what the issue is, because some things do take longer than others.
Okay. So it sounds like the things that can help, that can hold them back, are, the insurmountable challenges that face them. And it sounds like that's really expressed as, I guess, an internal thing, a feeling that they can't really act against the system. Are there any external things that people might, like practitioners might say, that could potentially hold them back from adopting your new way of looking at things, your new paradigm? I mean, you mentioned, for example,
I find it hard.
You mentioned the NHS, because so in the UK, as you say, healthcare is free at the point of, what do they say again? At the point of care.
Point of service. Yeah.
Point of service.
Yeah.
So
yeah.
Is that one of the things that's an external barrier?
I mean, people may see things as external barriers. I'm thinking about if they were to just, the barrier to just getting on the course and getting on with things. It's hard to see what the actual real external barriers are. I mean, if you're, I think it might be things like time, the perception of time, time and money, I guess, in terms of getting on the course. Yeah, I find it hard to think of anything that's really physically in their way. Because at the end of the day, what I'm dealing with practitioners, and they're people that have devoted to alternative healthcare, they're devoted to a holistic paradigm. They've spent time and money on learning something, and they're trying to make something work. So a lot of those barriers that exist for people, they've had to overcome to do their therapy. So I suppose there is just the physicality of getting on with it and getting the time and money together. But apart from that, I don't see any real physical barriers, because I'm not asking them to buy any diagnostic machine. I'm not really asking them to learn a different therapy. It's actually enhancing what they already do. And there doesn't have to be any commitment to a different philosophy of life. It's like, how does this dovetail into what they're, it's almost like they're on this road, and they're just hitting up against these little obstacles that we can pull out of the way and make life a lot easier for them.
One of the things that I recognize as you were talking about the mainstream medical world, you talked about doctors being the custodians of a whole range of diagnostics. Now, can your practitioners who adopt your paradigm work with doctors to get access to the diagnostics that can help with the adoption, with the new way of thinking? So if I ask you directly, does it help you to have access to diagnostics that doctors use for you to help your patients?
Well, it helps a lot, actually. It does help a lot. And I think that's a good thing. And it helps people to embrace a lot of the advances that have been going on in medicine. So it's not so much that we don't need to know what all the markers are. We need to know what they are, because they also help us to know if what we're doing is working. Yeah. Now, it wouldn't be so easy, to be completely honest, it's not so easy to work with the medical profession per se. I mean, what you're actually doing is you're working with your patient, and your patient is the one that's working with their GP and perhaps working with you. So that's really the way that it works. It's the locus of power is with the patient. Now, the patient often comes with diagnostics and results and things because they've got some condition they've not been able to deal with. So they often come with that. And I often encourage them to keep contact with the healthcare services so they can go back and they can keep monitoring and stuff if they're allowed to do that. So I would encourage that. We also help them to see that in a more holistic way. Okay, what does these blood test results mean? What does that glucose level mean? What does the cholesterol level mean? And so on. So we want to know that. We want to know what it really means in terms of what's happening with that patient's body and why is it happening. So I think it's great to have all those results. Now, you can't necessarily, you can't tell the service what to do in terms of testing, but you can certainly turn up and say, I've got these symptoms. Is there anything you can do to find out what's going on? And they're amenable to helping you find out what's going on. On top of that, there are private services now quite readily available. So we've got things like Medichecks where you can just literally put a sample of blood on a sample kit that they send through the post, and they can do all kinds of blood tests and things for you, right from kind of well-being checks, hormones and vitamin levels and mineral levels, to other markers that we would normally associate with the NHS services. So there's lots you can do privately, and there's a lot you can do within the existing NHS. But I encourage people to do both, in fact, and obviously do my best to help them and interpret that in a way that helps them to understand what's going on from a holistic point of view, as well as from their point of view of orthodoxy.
So with your course then, or on your course, do you help your practitioners to understand what the diagnostics mean from your new paradigm?
Yeah, exactly.
Okay, fantastic.
And because there's so much of that, the end bit is really useful. So, for example, if somebody has this real interest in something that we haven't covered in a lot of detail, I could do that with a specific practitioner if that's their thing.
Okay, well, that sounds very useful. Okay, so is there anything else that you would say that we haven't covered that practitioners could maybe do with having a quick high level about, so that they can decide whether or not to pursue, I guess, taking your new paradigm into their embrace?
Yeah, I suppose the one thing we haven't spoken about much is the whole mind-body thing. And obviously there's a lot involved in that. We do quite a lot of that on the course. But one thing is that we need to take into account is that people are often afraid in disease, and they're afraid of disease. So when people get ill, they get scared. And often they don't find relief in the current systems, the orthodox systems, because the orthodox systems tend to look at worst case scenarios and how do we help you not die, basically, or not develop this real bad cancer, or not get this and the other. So, and that does something to their psyche that's often quite detrimental, to the point where people often avoid going to the doctors and often going to A&E and healthcare services because they don't want to know. They don't want to be told these terrible things about what could happen. And so what I find really helps people is if you can understand their dis-ease from the perspective of the intelligence of the body, it also helps them to feel at ease with what their body's doing. They don't feel so afraid of what's going on in their body. And that in itself is a massive load off people's shoulders when they're ill. And if you've got that perspective that you can give them, that's a real gift that you can give your patient. It's like, okay, look, this is what's happening. And it isn't that your body's completely malfunctioning and you've got to worry about all this thing. This is your body really trying to help you, and this is how it's trying to help you. And we can do a few things to help that along. That's a very different place to come from. And because it's different, it alleviates stress and anxiety. And because it alleviates stress and anxiety, it helps the healing. So even if you didn't do anything that different, if you can change that angst in that patient about their illness, you can also help them just by doing that. So there's a lot of ways you can help people that that are not apparent by the struggles that we have in alternative healthcare.
So this almost sounds like, I often hear about when people get cancer diagnosis or really serious illness diagnosis, that when they hear that, it can be such a shock to the system that it actually almost speeds up the illness and as you say, like terrifies them into the at the same time. So you're saying that armed with this sort of paradigm of the intelligence of the body, that can be explained to the patient, and it can obviously be explained to the practitioner. Once they get that, they can then almost put a pinprick in the seriousness, or not that it's not any more serious, but it can, because of the explanation, it can take away some of the acute fear that patients have. Have I got that right?
Yeah. That's right. And that's, and that also is in the research, so we know about what they call the nocebo response, just as we know about the placebo response. There is a nocebo response that when if you tell something detrimental is going to happen, something harmful is going to affect them, then it will make things worse. So,
and is that what you meant by the mind-body issue?
Yeah, that's one element of it. That's one element. It's a significant element in the patient when it comes to that business of the diagnosis and what's going on with them. But of course, the mind-body issue would have been alive and active throughout their whole life. So it would have been also a part of their condition. A part of everybody's physical condition is a psychological condition. Everybody.
And I guess, is that the part where alternative practitioners have perhaps got already a little bit of an advantage? Because do many of them already have that as a part of their existing paradigms?
Yeah, they do. So they have an advantage in as much as that's much more acceptable for them, and they've got some sort of a map for that. But there are possibly even maps that they don't have for that because of, how does the psyche exactly relate to someone's, condition, their liver function or their eczema or their ductal cell carcinoma or whatever it happens to be. And those things have also been researched that we'll do on the course as well. So yeah, there are specifics, there are generals, and then there's the whole business of just being ill and getting anxious as well. Yeah. Wow. All those things are part of the story.
Okay. Is there anything else that you would like to mention that perhaps we haven't so far?
I think we've covered a lot. I think
we have covered a lot. Yeah, we have.
Yeah, I mean, there are always questions, there's always answers, but I think we've covered a fair bit of ground.
Okay, so for all those people, sorry, carry on.
No, go on. Yeah.
So for all those people, especially practitioners who have watched this, what should they do if they're interested in taking this further and finding out more about what you do? What's the best way for them to do that?
Probably to go on trevorgunn.com and contact me there.
Okay.
So that's probably the easiest thing. Yeah.
And that's Trevor Gunn. Is that one N or two?
Two N's, yeah.
Okay. trevorgunn.com. So they just go on there and there's a section on the site where they can make contact with you and find out more, yeah?
Exactly, yeah. There's a contact page. There's even a little page on practitioner development and so on in terms of how to contact me. Yeah. Okay,
fantastic. Well, I mean, this has been a fascinating episode for me, Trevor. And at the core of this whole thing about the intelligence of the body, I think for me, again, not a practitioner, but that for me really stood out from this session. So many parts I thought were really fascinating. And I think it's obvious that in the Western world, we definitely have like a chronic illness problem. And if your paradigm, which we need to stress, isn't, you haven't discovered, but you've really basically joined the dots from your medical, but orthodox scientific background in combination with your alternative health and with the time you've spent out there in the world helping patients, you've pulled this together, and you can see that this is a way of thinking and applying health that works. It all seems to make a lot of sense. I'm sure there'll be a lot of doubters out there, but that's why they should. But those people who think that that there could be something here that could help them should really take it to the next level and come and join you and find out more. Do you have a number? Do you have any other like little mini courses to give people an introduction to this, or is it really just simply getting in touch with you and taking it from there?
It is at the moment, yeah. I mean, there have been kind of short things in the past, but it's kind of whittled down to this main thing that I'm doing. Yeah.
Right. Fantastic. Well, Trevor, listen, this has been a fascinating episode. I've really enjoyed it. Thank you so much for spending your time on the Business Alchemist podcast. And I look forward to hearing about all these practitioners who are coming your way and adopting this paradigm of yours.
It's been a pleasure. Thanks for inviting me, Phil. Yeah, thanks a lot.
You're welcome. Thank you. Bye-bye now.
Bye, Phil.